Hi everyone, hello again. I'm Sakina Al-Junaid and I'm here with you in another episode of Doctors Go Live on Columbia Asia Facebook. So welcome one and all. Thank you so much for being with us again. So today we've got a very important topic to address. I will let the next montage do the talking. Okay, let's have a look at what our topic is today.
Assalamualaikum and hi everyone. I'm Dr. Rahidah from Columbia Asia Hospital, Iskandar Puteri. As a consultant psychiatrist, I feel it is important to address mental health issues, especially during MCO. Lately, there have been increasing cases of suicide and depression. It's a tough time for everyone. So come and join me on Doctors Go Live on 11 August at 3 p.m. to find out how we can keep our mental health intact. See you soon.
So there you go. That is going to be our topic for today. Okay, I don't need to be smiling so much because it's a very important and serious topic for us to address, especially during this MCO. So let's just start by giving a very warm welcome to our expert today, all the way from Columbia Asia Hospital, Iskandar Puteri. Hello, Dr. Rahidah Abdul Rahim, our consultant child and adolescent psychiatrist. Assalamualaikum, doctor. How are you today?
Waalaikumsalam warahmatullahi wabarakatuh. Hi, how are you? Sakina.
Good. Alhamdulillah.
Hope everything is okay over there. Yep.
Yeah, everything's okay. We're all working from home and I
Yeah.
hope everything is good also in JB. What's
Yeah,
the
so far so
scenario
good.
like over there? Do you have a lot of patients these days?
My patient is as per usual. They still come, because mental health an issue that is rising right now. So parents, patients, they are kind of like come to the appointments as it is.
Yeah. Do you notice that there's a higher attendance of patients during this pandemic, or it's just
Um,
regular like even before COVID time?
I do see more cases related to depression and anxiety more than other cases, and I do see also parents that bring kids that have they have existing problem like autism or ADHD or some other neurodevelopmental problems because during
Yeah,
this
I see. Okay. Now I'm just checking
time
out whether there is a
environment.
lag. Oh, there is a lag. Okay, sorry, that last part tadi we just got cut off for a little while.
Oh,
Sorry, you were saying that last part?
you children with neurodevelopmental problems like
Yes.
autism and ADHD and mental retardation. So it's like a bit more difficult to manage in a confined
Yes.
environment. They kind of like cut
Yes.
off from therapy and stuff. So
I
they
see.
show a lot more behavioral issues.
I
So
see. I
parents do
see.
come
Okay.
in to get more management on that lah.
Yeah. Yeah. So is the isolation, it actually is making some difference lah when it comes to
Of course,
handling
of
mental
course.
health, yeah?
Yep,
Yeah.
yep,
Okay, all right.
yep.
So I'm sure that you cannot overstress the importance of addressing mental health, especially during MCO. And then lately, as you have said, that there have been in the media also there have been increasing news of suicides, depression, and whatnot. So during times like this, we need to read the early signs of mental stress, and that is why we are here today, so that you can guide us and you can
Yep.
make us more aware of loved ones, family, friends, and whoever our significant others.
Yep.
Maybe we can start off by addressing the definition of depression. Okay, I hand it over
Okay.
to you, doctor.
Yes. First of all, I might be, when I'm a bit stressed or anything like that, I might be bilingual. That's lucky for me because I
Tak
only
apa, it's
know
okay,
two
no
language.
problem.
Nasib
Kita
baik
orang
tahu
selalu
dua
memang
language je.
bilingual pun, ya. Pretty casual, don't worry about it, it's
So
okay.
kalau empat language then lebih difficult lah.
Wah, got
Okay.
4 language.
No lah, I
Masya
only
Allah.
know two. Lucky me. So I go
Oh,
bilingual
yeah.
is English or Malay ni lah.
Oh, yelah.
Okay.
Doctor, before I
Okay.
start, I just want to
Yeah.
let everyone know that you all can actually ask questions if you want. You can just type your comments. If you've got anything to share with us, doctor on the spot pun boleh addresskan doctor kan, since
Yep.
I mean might as
We
well you
will
take
see. Yeah,
advantage of
insyaAllah.
this
Yep.
now. Yeah,
Okay.
kan? Inshallah, yeah.
Yeah.
And then wait, before we start, I just would like to ask you, doctor, how long have you been practicing psychiatry?
I started off psychiatry in 2005.
Mm.
Yeah, 2005. Then
Mm.
I took my master's and become a specialist in 2011.
I
Then I
see.
took, and then I take my, I go on do general kind of psychiatric things like, the
Yeah,
adult
yeah,
one. Then I go subspecialize in children and adolescent, and I graduated in 2018.
I see, I see.
Yeah. Mm-hmm.
You chose to do psychiatry. Was that something that you've always wanted to do, or was it
Actually,
someone else's
yeah,
interest?
no, actually, it's not really that. My personal interest is actually in pediatrics. But then,
Oh, okay, all right.
yeah, we choose the path that is destined for us and make the best out of it, kind of thing for me.
Yeah,
Yeah. So
yeah,
I really learn a lot, in terms
yeah.
of patient management in general in psychiatry, and it, like, create my interest in that. Yeah.
Yeah, yeah.
Mhm.
Do you get when you are in this line and then you interact with people, do you always try to figure out, oh, dia ni macam ni, because you
Oh,
already
no, no,
have
no.
that
I
tak
mean,
payah lah,
no,
the rest of us
I
sometimes we
work,
think we
I work
try
until
to figure out
5.
what this person is like.
I
Really
work
like
until
that lah.
5. Yeah, no, no. I work till 5. So whatever, and then you say that probably I boleh baca fikiran orang ke, analyze
Like
everything. And it's
analytical
only
all
until
the
5.
time.
Yeah, it's
I see,
only until 5. You see. So
I see.
some other times I'm just this neurotic mom. Very very
Oh, okay.
very
Wow.
very talkative friend or something like that. But yeah,
Yeah, yeah.
it's
That's
it's
so
something
cool.
I do. Yeah.
No, but imagine that a mom who is a consultant child and adolescent
No,
psychiatrist.
I mean, I
Wow.
shout from here to there, the other end of the road, and people can hear me because I'm the usual mom,
So that's
typical mom.
regular lah. That one we all can relate.
That is regular. Tak ada apa
That's
beza
great.
pun. Just
That's
that
great.
the perangai kanak-kanak ni, the behavior,
Yeah,
how well we are open up to, learning new things about them, and
of
manage accordingly
course.
lah. Yeah.
Yeah, betul. Because we're not staying in 20 years ago, things are really different. And then what with this
Yep.
new norms and whatnot, kan, I'm sure
Mm,
there's a
mm,
lot
mm,
for us to
mm.
talk about here today,
Yeah,
especially.
yeah,
So,
yeah.
okay, doctor, as a child and adolescent psychiatrist, you are practicing now at Columbia Asia Hospital
Yes,
Iskandar Puteri, ya?
yes.
Okay, and then yes, of course, we've got a psychiatric department dekat Hospital Columbia Asia Iskandar Puteri, and Dr. Rahidah, just to clarify, she sees patients below 18 years old because that's a
Yes.
specialty, yeah, child and
Yep.
adolescents. But we also have another doctor, Dr. Silva. He is also a
Mm-hmm.
psychiatrist at the same hospital, and he
Yeah.
addresses the adults. So
Yep.
any kind of problems that you have regarding depression or any mental health at all, you can always call me Asian
Yeah,
Hospital
yeah. I
Iskandar
mean,
because they've got the
uh,
areas.
yeah. I mean, before I go into child psychiatry, I also memang
Yeah,
kita kena buat general psychiatry.
correct,
So it's
correct.
like,
Yeah,
yeah.
yes, yes.
Yeah. Mhm.
Okay, all right. Doctor, now let's start with our topic for today about depression. Yeah. Okay, doctor, when we mention depression, how do doctors see depression as compared to how laymen, normal people see depression?
Mm,
Because when you see depression
mm,
in their mind, maybe it's just macam, alah macam ni je, depressed, menangis, and then
betul.
maybe sad
Yeah.
music. That's
Yeah.
that's just how ordinary people describe it. But actually, what is depression from a clinical sense?
Um, Selalunya kalau kita cakap pasal depression ni, I mean,
Mm,
orang Melayu dia tak banyak definition tau sebenarnya
mm,
kan. We
mm.
always use the word sedih. Sedih is kind of like a general word that means everything in those
Yeah, that's
lines. Okay,
sadness.
and then yeah, and then the other word is murung. Murung is jarang guna lah, jarang guna. Okay, and then if you see children
Mm,
and adolescent, they will say, no, I'm not cool, I'm not okay. So
mm,
sedih is kind of like kata yang biasa digunakan. But to say depression is actually is a distinct mood, which is rasa perasaan yang sedih yang amat sangat, yang berbeza daripada sedih-sedih biasa. We do rebound
mm.
from low mood, macam bila kita somebody passed away, kita sedih,
Yeah,
ataupun we
yeah,
go through some life event. So we rebound back. Kita
right.
kehilangan sesuatu macam our pets, so kita
Uh-uh.
rebound balik. Tapi depression is something that you don't just rebound from it. You don't.
I see.
Okay, so it can be kalau kita cakap pasal depression, it can be the mild symptoms like I'm sad, or it can be
Mm-mm,
like a
mm-mm.
depressive disorder. So when we talk
Right.
about depressive disorder, that is the clinical depression. This is when I will
Mm,
use certain sets of criteria, certain set
mm.
of apa ni, assessment, and then ada
Yeah.
time range, and then how much it affects our daily life. Okay,
Mm,
so
mm,
maksudnya bila I say a disorder, a disorder, it means depression tu atau kemurungan tu menyebabkan kita tidak boleh fungsi macam biasa. So probably as a mom, I cannot function. I tak boleh help out
Yeah,
my kids. I'm
yeah,
tired all the time. I'm sleepy all the time. And as a daughter, I memang tak boleh tolong my parents. As a doctor, I tak boleh kerja. I maybe there's certain kind of
that's true.
behavior that is
Yeah,
affecting,
yeah.
yeah,
So it
the
gets in the way of
depression
life
symptom.
lah.
Yeah, true. It just affects the way you think, the way you
Mm-mm.
act. So depression is everything. Kalau orang tanya I lah, doktor, kalau minta tulis satu, tentunya ignorance kan. Which part of the organ is affected by depression? Actually, it's like from head to toe. You know, got pain with this, pain. There's some
Yeah,
hopelessness, helplessness, sakit badan, sakit
yeah.
kepala, and all those stuff lah.
So you actually can, when we're talking about depression, it's not just mental. You can actually feel. I mean, your body
Yes.
also,
Mm,
what's the word?
being
Your
affected by
body
it.
also shows the impact of depression.
Yep. Yes.
I
Mm.
see. Okay.
Memang you can from head to toe, like
Would you say
systematic
that?
mental.
Would you say that depression ni yang sadness berpanjangan, like you just cannot move on from whatever it is that you've been triggered by? For example, when you
Yeah,
said
I mean,
that, but you just cannot pick yourself up, you macam berpanjangan lah sedih tu. Is
yeah.
that it?
I mean, kita akan ada, kita biasa kalau kita bincang pasal sadness ni, dia ada yang distress, yang macam kita it's a sesuatu yang trigger and it happen. And then kalau
Mm-mm.
you tak dapat bantuan, it can prolong into this disease that we call depressive disorder. Sebab tu kita perlu tahu
Okay.
distress tu how much we can
I
withstand
see.
and
I
when to
see.
get help. When to get help. The
Okay.
important part is
Okay.
where do you
Yeah.
go? Yeah.
Yeah, I understand we've got some slides kan. Until later we're going to go into distress, the difference
Yeah.
between distress and disorder. Generally, doctor, can you let us know some stats that you have? Like how bad is it now? What kind of stats are we looking at?
This is something I gather from the National Health and Morbidity Survey. I mean,
Yeah, this is
where
it.
is it? Okay, yeah, that's the slides. Yeah. So in generally kita ada population of 2.7 million, and we found that National Health and Morbidity Survey in 2019, there's around 2.3% of adults have depression. It's not actually a depressive disorder, but more of depressive symptoms. Okay, that's about more than 500,000. You see, and
Okay.
with this number, it can just progress into something more than just depressed mode. Okay,
Okay.
and in 2017, we found that 1 in 5 adolescents have depressive symptoms, and this is even bigger, which is about 20%. Okay, so
Mm.
if satu kelas tu ada 50 orang, 10 apa? 10 akan ada depression lah.
Wow. Yeah,
Something like that. Yeah,
that's high.
1 in 5. Yes. Tapi again, this is depressive symptoms. It means that some of them have milder symptoms like I'm just tired, I'm just sad, and probably at that point of time they have something going on. Up to those people, up to those adolescents who have real problems like memang depressed, memang low mood, memang have a lot of self-harming or suicidal ideations. So it's just a array of range of symptoms that we have. So 1 in 5. The NHMS 2017 is self-rating, so they rate themselves. It's
Okay.
actually
Sorry, Dok, but
30,000
the,
adolescents.
the sound is not that clear. We keep getting cut off. So macam a bit.
Sorry. Okay.
It's okay. Okay,
Can
ni
hear
macam
you
setakat
well.
tu sikit. Okay, yeah, this is fine. This is better.
Okay.
Okay,
All right. Okay. Okay. So,
nice.
yeah, this is all the range lah. It's not like real depressive disorder. Memang kita susah nak
Mm.
dapat sikit lah the statistics of this. Tapi
Mm-mm, mm-mm.
roughly
Yeah,
self-rating, this is the range that we have lah. Okay.
self-hating.
Right. Rating. It's we rate our macam yang
Oh,
NHMS
self-rating. Okay, okay.
Yes, 2017 ni, the adolescent rate themselves. There's 30,000 adolescent who rates this, and we found out that 1 in 5 of them have depressive symptoms.
Okay, what's the
So
difference
dia
between depressive symptoms dengan full-on depression disorder?
disorder tadi tu lah yang yang penting disorder mesti ada faktor yang menyebabkan reduce in functioning ataupun
Okay,
dysfunction. Dysfunction in a person lah, sama ada daily living function ataupun macam
yeah,
self neglect, ataupun lagi
I
satu
see.
ialah
Okay.
uh, in terms of dia punya occupational functioning.
So for as long as a person dia sedih but then dia boleh lagi function dekat tempat kerja atau dia boleh belajar,
Mm.
cuma dia down lah, that one is depressive
Ah,
symptoms. I see.
that's sadness. Yeah.
Okay, okay.
Mm.
All right. Which if we're not careful can turn into depression.
Yes, if you're not getting help properly,
Berpanjangan
can
lah.
turn into
I
depression.
see.
Yeah,
Okay,
yeah.
let's take a look at a global figure. I think you've got this next slide. Yes. What
Okay,
is this
so
about?
kita ada banyak study yang dilakukan di banyak-banyak negara. So they figured out that 300 million people are affected by depressive disorder lah. Okay,
Yeah.
so ramai orang yang ada. It's a common illness actually. It's common illness, but um, there is a lot of stigma surrounding it that people susah nak dapat rawatan ataupun susah nak kita nak susah nak open up because a lot of depressed
Yeah.
people will feel like they are weak. They are weak ataupun ada
Yeah.
stigma around it, So the treatment untuk pencapaian atau untuk mendapat rawatan agak hinders lah
Yalah. Yalah.
if it's like this. Okay.
Sometimes I think also people tend to they don't want to see psychiatrists because like doctor mentioned tadi stigma kan. So but do you
Yeah.
think that this day and age people are still very wary of going to see a doctor for mental health as
I
compared
think
to
more
say
people
about
are
20, 30 years ago?
I mean, now more people are actually turning up. More people are turning up because
Mm,
okay, sebab mental illness ni sama juga macam illness yang lain. I mean like
correct. Yeah.
sama juga diabetes, hypertension, there's a target organ. There's treatment for that, because sebab tu ada ubat. Sebab tu ada ubat because
Yeah.
there are neurochemical imbalances in the brain that we can deal with, and then we have therapists who can help with. Dan bila disease ni tidak berpanjangan kan, dia akan return of function can come very fast. If we allow it to go, I mean go on and on, the return of function is a little bit hinders lah, susah sikit nak kembali kepada fungsi yang asal tu.
Right.
I mean now
The
more people
onset.
are coming. The
I see.
onset, okay.
That's
I mean, there is variety of onsets. Sebab depression ni can be, dia ada bertinda-tinda dengan pelbagai diagnosis. For example, like kita ada purely depressive disorders, kita ada bipolar mood disorders, whereby there is depression and mania. Mania means depression means low mood, mania means so happy mood. And then
yeah.
there's postpartum depression, and then there's dysthymia. Dysthymia means some low mood but long time, 1 year, 2 year, yang panjang tapi tak teruk, but it's long lengthy. So we have different different onset. But in general,
Yeah.
a lot of I think about 50% of mental illness started adolescent, in adolescent years. I think there's a slide on that.
I see.
Kebanyakan mental illness ni akan bermula pada umur remaja. Sebab tu tapi remaja ni kita selalu bayangkan mereka ni macam okay, a period of adolescent is a period where everything goes like chaotic and haywire, and a lot of this
Yeah.
is not being recognized. Not being
I see.
recognized. And then parents thought it was just a phase, fasa, and then people move on. Okay, but actually a lot of major mental illness like OCD and major depressive disorder, substance use or anxiety start off at about 14 macam tu.
I
Okay.
see. Doctor, I'm sure you've seen many patients. In
Yep.
your from your experience, what is the common reason for depression among adolescents? Because you were saying that usually they start daripada muda lah, adolescent, and then as you go into adulthood, and then it can become full on depression. But usually, what is the one common reason? Selalu nampak macam kes ni lagi sama je dia punya punca kan?
Okay, so macam adolescent ni, I mean jarang sekali kita dapat kes yang satu je sebab dia. Usually it's like a walk with yen, It's like dalam satu kuali tu dia ada jumble up
Oh,
of many things when it involves adolescent. Contohnya
yeah,
macam ada parental issues, attachment issues, lepas tu school issues, and a lot of peer issues, masalah dengan kawan-kawan,
yeah,
because during adolescent period kan, kita masa tu kita belajar untuk berkomunikasi dengan a bigger social circle. Okay,
yeah.
that's our peers. And then bila ada problem dengan peers ataupun they don't feel belong, itu akan create anxiety, and some of them move on into depression lah. Okay. So selalunya masalah dengan peers lah. We've also found out in the National Health and Morbidity Surveys
Yeah.
about higher percentage is because of peer issues. Peer masalah dengan kawan-kawan lah. Yeah.
Yeah. I think you've got a chart on this about the different ages and what is it that
Mm.
influences their emotional being.
Yep.
Can we take a look again at the slides?
Yes,
This one.
this is the slide.
Yes.
Yes.
Perfect.
So you can see that the onset tu kan, memang dekat kebanyakan dekat adolescent, but most of it kita akan dapat detect sebab bila
Mm.
dia orang merasakan bahawa masalah dia orang ni dah lama, dan after certain time dia decide okay, I need to go and find help on my own. Okay.
Yeah.
Sebab
Yeah.
bila dia bawa umur ni, yang penting ialah siapa yang menjaga, who is taking care of these kids, who are taking care of these adolescents, to figure out okay, this is
Yeah.
something that we need to work on.
Mm.
Kalau tidak, memang kena tunggu dia orang dewasa lah, sebab dia orang will find I'm not well.
Mm.
I
Mm.
need yeah. I need to find ways to help myself.
Yeah.
Yeah.
How serious is depression in teenagers? Yeah, doctor.
It's quite a thing, especially kalau kita cakap pasal COVID kan, sebab
Yeah.
the major orang kata task at this
Mm.
adolescent age is actually to socialize, to
Yep.
learn from circle outside their home, where at this
Correct.
time sometimes parents don't worry because you are not the one they look up to. They tend to find something outside. Yeah,
Yeah.
they depend on peers and friends and teachers, coaches. So waktu ni bila berlakunya this lockdown kan,
Mm.
kebanyakan socializing ni akan berkurang lah. And then adolescent juga, when they have something inside yang tak best, contohnya macam rasa tak keruan ataupun rasa,
Betul. Yeah.
they find friends outside to talk about it, or they play games, main bola ke apa, and then that kind of like sort it out. But now dalam keadaan yang lockdown ni, COVID ni, they can't go anywhere. The only media they have is probably phones and then
Yeah. Social
internet
media.
kind of thing.
Yeah.
Yeah, but then bila ibu bapa nampak tu banyak on social media pun
Mm.
agak sukar juga kita kan nak
Of
asyik
course.
pakai
Of course. Yeah.
telefon je kan.
Yes.
Sometimes
Yep.
adolescent ni dia pun tak tahu sebenarnya nak berhenti dekat mana, sebab kalau dulu ada rutin pergi sekolah, balik sekolah, and then there are times when I look at my phone. But now it's like all the time I'm looking at my phone for I don't know whatever reason lah. Okay, ada masa untuk belajar, ada masa untuk
Yeah.
entertainment, and everything is there.
Correct.
So kita
That's all there
as
is.
parents, as parents pun kita rasa macam tak shock dengan benda tu kan kadang-kadang. But
Yalah.
mm,
But what kind of advice do you give your patients ataupun the parents? Like, how can you make things less depressive dekat rumah?
okay. I selalu cakap dengan we will look into what is important when we talk to someone. I mean, if I talk to any adolescent or even our colleagues or even whoever adults, I have to see what is important to them. Apa yang penting pada mereka. Then the advice is given accordingly. Contohnya kalau the adolescent just cakap, I need to talk to my best friend, then we will provide ideas on how they can have uh, communication. Some people
Yeah.
say, no, I don't need my best friend. I just need to do good in my PDPR ataupun online learning. So we work on that. I know doctor, I have no focus, I have no concentration. Then we work on that. Okay, they very much depends on what their needs are. Okay, and the other thing is that kalau macam children kan, children senang, you play with them. We play with them. Adolescent ni is a little bit difficult. Sebab most adolescents like to be alone kan. Tapi
Yeah.
parents tu kena banyak kita tak boleh intrusive, but we do ask parents to reconnect with their adolescent and talk about what they like. For example, I mean, a lot of adolescents nowadays that I see love animes, contoh lah
Mm.
anime, whatever anime lah. Tapi
Yeah.
bila I ask parents, do you watch anime with your kids? They were like, doctor, I don't watch anime. Ataupun K-pop, doctor, I'm not sure what she's talking about, there's BTS. Every macam dia punya
To
K-pop
take some
idol.
interest lah.
So where
Yeah.
you don't have that platform doing the things that your punya anak suka,
Yeah.
adolescent like, then there's no way you can get, them to really communicate with you.
Macam
So
two different
ada
worlds,
some
right?
parents, yes, some parents really like get to know some anime, character, some join their penyakit in K-pop punya videos or anything like that. So at least it's a good way to go lah, because kat rumah kita pun tak ada buat apa sangat kan.
Yalah,
Jadi
that's true.
ini adalah benda yang penting lah. Bukan tak buat apa lah. Maksudnya if you try to live harmoniously in a one house, these are the things that we need to do lah. Yeah.
Well, that's good. Okay, doctor, I see that
Mm.
you've got this article here. It's called Escalating Progression of Mental Health Disorders During the
Mm-mm.
COVID-19 Pandemic. Evidence from a nationwide survey. Maybe you want to just explain a little bit about this?
Yeah, it's actually sekarang banyak study yang keluar, dan dia ada range macam-macam lah, because
Yeah,
this kind of new disease yang you know kali dengan COVID. Maksudnya when I say COVID as a pandemic, this is what depression, anxiety is what we
yeah,
call shadow pandemic. It's a shadow because the real pandemic, there's something else is happening lah. Okay, and then I just took this one article just to highlight how much this is affecting us. Okay, so for this one, they did the study from May to September to 2020, and
okay.
about depressive symptom yang dia dapat about 60%. 60%. So a lot of people are really, really depressed. A lot of people are anxious. Okay, and
Because of
most of these,
COVID-19? Because of the current
this one is in
situation?
relation, yes, in
Okay,
relation to COVID-19.
yeah.
And then one of the indicator, predictor ataupun yang boleh orang kata menyebabkan mereka merasa demikian, ada perceived health status. Sebab waktu COVID ni kan kita tahu ada kriteria penyakit yang menyebabkan the COVID itself become complicated kan, complicated. Maksudnya kalau kita dah ada penyakit darah tinggi, kita dah ada comorbid, kita dah ada a bit on the obese side, kita ada lungs problem. So orang yang ada masalah rasakan kita kena COVID nanti macam mana. So itu yang menyebabkan mereka rasa macam trap. Depression is about feeling trapped, you cannot move on, you cannot go in, go out, benda macam tu. Okay. Jadi bila kita, tapi sekarang ni you can see the progression lah. Ini pada tahun 2020 masa penyakit tu mula-mula. So maksudnya
Yeah.
COVID itself, yeah. Now it's like the other variant is coming in, which is more very difficult to know what's gonna happen. So perceived health state sekarang ni macam orang tak berapa sangat, semua orang boleh kena sebenarnya. Yeah. So
Alamak, I think the
it's
sound dah
about
macam going off a little bit. Just a little bit. Hello? Okay.
Yes, I can
Okay,
hear
it's
you
fine.
very well. No,
Okay.
I'm not sure.
Okay.
Okay.
Okay, so let's take a look at
Yeah.
what next. So all these findings lah yang macam you mentioned tadi kan. Okay, depression and COVID, lockdown, restriction of movement, is abused. Okay. This is a serious matter because during a lockdown, you can't go anywhere. So basically a sitting duck there for cases of abuse, whether it's child abuse ke, spouse abuse ke. Do you come across
Yes.
these as well?
Yeah, apparently yes. Sekarang
How
ni
do
itu
you
pun
handle it?
another shadow pandemic that is highlighted by UNICEF. Okay,
Yes.
it's because because abuser dengan yang di abuse is sitting in one house, and abuse can happen
Yeah,
repeatedly. And during
correct.
lockdown, kita tak ada macam kalau dulu kan without lockdown, these cases can be identified at school, or
Correct,
when
ya betul. Ada
kita
tanda-tanda
jumpa
semua
kawan.
kan? Hmm.
Dan kalau kita jumpa kawan kan, maybe socialize, kita minum petang tu, kita tanya, kenapa bengkak, kenapa mata
Ya,
you,
betul.
kenapa lebam. But now
Uh-uh.
there's no way that we can identify this. Okay, unless kalau kita memang kaki sibuk lah, kita sibuk selalu tanya kenapa, macam mana, bagaimana, kita dengar orang sebelah bising, kita sibuk tanya kenapa bising,
Kadang-kadang sibuk ni bagus juga kan? For a good reason.
Yes. Yep. So sekarang ni itu yang kita panggil, dulu kita panggil bystander, people who just look, hoping somebody else will do the report. But now kita galakkan the revolution, what we call upstander, people who really want to know what's happening and want to report and want to take charge of, apa benda yang berlaku yang sekarang ni lah. Kita nak tahu apa yang berlaku dekat orang sebelah tu, kenapa bising. Benda macam tu lah. Okay. And then the part of the abuse that is very concerning is that kids atau yang being abused, it very much depends on how long and how much they are being abused. There's long-term effect that is associated with it. Okay, so they are at risk of 4 times higher to get some other mental illness. like depression, schizophrenia, bipolar, the severe mental illness. So lagi mudah nak membawa kepada masalah kesihatan mental yang teruk lah.
Yeah.
Oh,
Dok, certain
yep,
mental illnesses too, it's not something that you are born with.
yep,
It's
yeah.
you actually develop it because of a particular situation, because of a trigger, ataupun is it like macam like for no reason suddenly you just have it in you?
Ada certain mental illness tu is genetic. It's genetic.
Ah,
But
okay.
it doesn't mean that I can choose, my mom. So contohlah, my a mother with depressive illness, anak dia ada
Yeah.
genetic depression. Tapi it doesn't mean that I'm going to get depression. It very much depends on how aware I am of my condition.
Yeah.
I
Yeah.
tahu, okay, my mom is like this, so I'm gonna be aware of the symptoms. I'm gonna get,
Mm. Yeah.
treatment early. I'm gonna take care of my mental health, for example.
Right.
Okay, tak semua orang yang akan di-trigger lah,
Yeah.
di-trigger oleh dia punya mental gene, genetik itu. So dan ada yang mereka yang berisiko tapi mereka tidak aware. Tidak, dia kata, oh, my mom is like this, so I'm like this, and then terus-terusan lah jadi macam tu. Itu yang isu dia. Jadi mengenal pasti sekarang ni ialah lebih penting, especially kalau memang kita ada family history of some mental illness.
I see. So it does run in the family lah to a certain extent. Macam
To a
depression.
Yes, certain extent it does right in the family. For example, kalau kita ada twins, and kembar tu ialah kembar seiras. Kembar
Yeah.
seiras. So kalau satu kembar seiras tu ada depression, the likelihood of the another kembar to get depression is about 70%. Okay, contohnya macam tu. Tapi tak semestinya kita dapat lah. Maksudnya kita very much depends on how we manage ourselves and how we manage our mental health tu.
Yeah. Okay, let's talk about the next thing about loss of employment and financial security. Because some of this
I
memang
mean,
it's not something that you can fix kan. It's the
yes.
situation.
Yes. So
So
ada situasi yang kita memang tak boleh ubah lah macam ni kan.
yeah,
Tapi
correct.
macam mana kita nak keep, of course kita akan rasa sedih. Of course kita akan
Yeah.
rasa, tak sedap, tak selesa, tak best,
Yeah.
because there's a lot of loss going on. And a
Yes.
lot of us also keep finding ways on what should we do, what do I do next. Sebenarnya kita nak kena ada problem solving yang berterusan terhadap masalah ni. Sometimes we feel tired, sometimes we feel not okay, but I think after a while it's okay not to be okay to a certain extent, a certain period of time. Okay, then you back up balik and then you try again. Macam mana kita nak atasi masalah ini lah. Because if you don't, a lot of people feel trapped, and yang feeling trapped ni yang menyebabkan this feeling want to escape. And a lot of them cope differently when they want to escape. Dia macam banyak cara coping yang tak bagus lah.
Well,
That's
for
why
example,
suicide ideation, self-harming, start using substances, guna penggunaan dadah, just
yeah,
to cope
yeah.
with the current problem ni. Okay.
Yes.
Jadi the issue is, kita kena ada mental capacity untuk kata, okay, what's next? Apa lagi kita nak buat? Kadang-kadang perlukan kawan untuk orang bantu, untuk orang tolong. Just allow that to happen lah.
Yeah. Could depression stem from boredom tak, doctor? Because sekarang ni macam you don't have an activity outside of these four walls kan? So if you don't have anything much to do, is that something that can cause depression?
Ada boredom yang hingga membawa ke situ, because after one point dia rasa macam life is useless.
Yeah, like there's
Macam
nothing much going
dia
on.
tak achieve, there's nothing yang dia achieve, because human needs to feel that they achieve something. Every day you go to work, you achieve something. Sikit ke banyak ke, do something, movement. Itu kalau tanya in depression, right? Kita galakkan untuk bergerak. Contohnya if you bangun pagi, you tak tahu nak buat apa pun, you just bangun and then bergerak, have a schedule and move, because that movement creates more energy, and pun tapi it gets going. Tapi kalau you penat, then you bring, then you bored, the depression tu akan tak pergi mana lah, pergi kat situ je lah, on the chair, and then you rasa at the end of the day, I'm useless because I didn't do anything today, anything happened today, all those things gonna come in.
Yeah.
Mhm.
If somebody were to pick up hobbies, maybe there are certain things that you can suggest in order
Yeah.
for a person to just be stimulated supaya dia tak adalah macam murung kan, and just think about how
True. Okay. So
down
I
life is right
usually
now.
I will usually tell this to my patient. I mean, they conclude this from Harvard longevity study, because on happiness they
Yeah.
dia kaji macam for 80 years people who are happy, what do they do? Okay, so I think they conclude something like dia ada kalau kita apa yang kita nak buat waktu ni adalah kita kena buat tiga baik, three goods, three goods. Number one is just to do good to yourself,
To do,
berbaik kepada diri sendiri, do good to yourself.
be good to yourself. Okay. So I'm repeating
Yes.
because the line macam it keeps going off and on.
Okay.
So okay, be good
Okay.
to yourself,
It's
right?
okay. Do good to yourself. Makan okay, tidur okay, relax. You know when to relax. You know when to talk to
Okay,
people.
jaga
You know
diri
you
lah.
meet new friends. Okay. Number two is if you don't know how to be good to yourself, sometimes when we are stressed, we don't know like self-care tu tak ada. So we do to others. We do good to others. Maksudnya
Okay.
buatlah apa-apa pun yang kita rasa kita boleh bantu orang. Angkat sampah
Yeah.
ke, apa bersihkan
Be kind.
longkang ke. Yes, kalau dalam rumah
Of
tu help your
service.
mom, help your dad, do good because that is, and then acknowledge that you have done something that day. It doesn't have to be big,
Yeah.
but
Yeah.
you have done something that day. And then this is where the hobby comes in. Number three good is that do something that you're good at. Good at, you see. So kalau kita ada hobi tu, kita teruskan hobi kita supaya apa yang kita buat tu kita akan lebih baik, lebih baik, lebih baik. In time of stress, it's not.
Yeah.
Sometimes people choose new hobby. Kadang-kadang hobi tu tak boleh berjalan. Mungkin disebabkan we don't have much experience. Lepas tu kita beli barang baru nak kena beli. Sometimes when it didn't go as you plan, it become frustrating.
Yeah.
Kecewa pula lepas tu. Tu kita kan to do something that you good at. If you like cooking, you good at cooking, then you cook. Cook
Yeah.
and makan rasa and be good at it. Kalau you suka menjahit, I have friend who jahit baju, melukis, benda-benda macam tu
Therapeutic
lah. So
lah. Yeah. Some people. Yeah.
therapeutic. Satu level is so good
Yeah.
already that you feel confident to sell it.
Correct.
So dia menggana lah dekat situ where people have financial security,
Uh-uh.
insecurities, loss of employment. So from there, it can generate some other incomes lah.
Macam
And it's better.
macam doktor sendiri, I mean, I'm sure you also have undergone stress lah because of your work. It's very intense. So how do you? What is therapeutic to you?
I
What
mean,
helps you
I like
get through the day?
I have a lot of good friends. So we do like we do like Zoom meeting, few of us, that's one to keep the communication and
That's good. Yeah.
socializing. And then when on my own, usually I will go into painting, sketching, and drawing. Okay, how that helps is that when I'm focused on what is in front of me, focus on the
Yeah.
lines, focus on the colors, it helps me reduce my own anxiety, because anxiety, if you allow it to grow, it will grow bigger and bigger and bigger and will consume. So lepas tu
Yeah.
kalau kita tak control, tu dampaklah panic attack, rasa worry, worried. So I do that a lot. I mean, I do sketching and drawing now.
Oh, that's good. Yeah, I think we each need to have something to fall back on now. Okay, let's take a look at the slides again. Is there anything that can illustrate our topic today? What's next, Cecilia? Sorry, there we go. We've seen this already. Let's take a look at what's next. The next slide, Cecilia, if you please. Okay, I think we skipped
Okay.
this slide because this one, yeah.
Yeah. Mm.
Okay, what is this? Depression is a complex disease.
Okay, this is when I said that it comes in different forms. Like some people come just with depression, but then actually there are other diagnoses that goes with it. For example, if like bipolar mood disorder. Bipolar
Okay,
mood disorder
yeah,
is when you have these two moods,
yeah,
and postpartum depression. Okay, and then there's dysthymia, thymic
yeah.
order.
Yeah, you mentioned
Okay,
tadi ni lah.
yes, and
Okay,
then
okay.
very degrees of intensity. Maksudnya
Okay.
sikit yang teruk. Overlap with other conditions ni, for example, that you have certain medical problems, they do present with depressive kind of symptoms. So example, if you have anemia, chronic anemia, okay, so bila
Oh,
kita
I
punya
see.
kita punya blood cells tu reduce, kita
Mm,
punya oxygen tu reduce, kita nampak macam tak larat, penat, tired, lethargic,
yeah.
and it also brings like hopelessness kind of feeling. Okay, so
Mm,
something like that. Yeah, overlap the conditions. Some acute renal failure patients also have
would
similar
cancer be one
problems.
of that? A feeling of
Yes,
hopelessness.
yes. It's not. Sometimes it's not the some cancer patient are also motivated, but the symptoms
Mm,
is lebih kurang sama because in a
okay.
cancer patient they also
Yeah.
lethargic, rasa penat, rasa tak bermaya, kan, which is so typical of depressive symptoms. Okay,
Okay. Okay.
so
So
bila
those are
ada
the
kita kena
overlaps
tengok
lah.
lah. Yeah, yeah,
Okay.
something like that.
Okay, let's take a look at the symptoms of depression. Ada empat ni. Okay, maybe you wanna just run us through this.
Okay. This is the core like core thing that you see lah. Benda yang besar lah. Maksudnya emotion. Because
Mm,
depression ni kan like dia mempengaruhi semua kan. So dia mempengaruhi emosi, dia mempengaruhi pemikiran, it's your physical and also the way you behave. Okay.
yeah.
Kalau macam
Yeah.
contoh emotion tu macam it overlaps in a lot of things, but the main it should be sadness. Kita sedih.
Okay.
Some of it have anxiety. Okay, but it also most of depressed patient has irritability atau kita panggil mood swings. Okay,
Ah.
so
Okay.
marah tak tentu hal, tak tentu pasal, macam become
Mm,
snappy, become a lot of
yeah.
adolescent they will say become more sensitive. Kuat sentap ni doktor, macam tu. Kuat sentap.
Mesti nak marah je.
Okay, macam nak marah je. Okay, so itu pun kita
Sorry
kena
dok,
kaji lah
before
kalau.
kita before kita proceed, usually depression macam all these symptoms kan, would it be
Mm-mm.
something that others tell us ataupun we know sendiri so therefore we go to the doctor because
Kita boleh
we have a
rasa,
feeling that
kita
we
boleh
have.
rasa. Some of it kita boleh rasa, some of it people will tell. People will tell. Some of it, somebody people identified for us. Tapi kita sebenarnya bila orang cakap tu sebenarnya kita rasa, betul lah tu. Macam
Kadang-kadang
perasaan
kita
ni.
rasa defensive juga. Maybe somebody is trying to point out that there's a problem, but you know, like you don't want to
Yeah.
be told that you have problems, so you might feel a little
Yeah,
defensive and you
usually
don't
yang
want to
agak
speak.
defensive. Ya, sebab anger and irritability tu kan. Itu yang dia orang
Anger.
cakap. Tapi orang nak tegur pun kau marah. Kalau tegur macam tu orang yang dengar tu pun macam marah jugalah kan. Tapi it's about pointing out very subtly in empathy kind of situation. Taklah macam nak threaten dia kan. Duduk
Yeah.
cool down and masa dia tak marah tu cakap, hari tu aku nampak kau marah. Kenapa macam itulah. Bukan masa dia marah tu kita nak tegur. Then it's
Yelah betul
masa
je
tu dia
tu
akan
macam nak asal.
melenting-lenting lah waktu tu kan.
Dah lah punya mood tu kan. Okay.
Bukan waktu itulah. So the right timing lah.
Mungkin dia ada tag lah, tactical.
Yes.
Okay, the next slide ni I think there's
lah.
ada list of symptoms kat yang berkenaan dengan emotion. Okay.
Yes. So yeah, I
We went
mentioned
through this.
this lah. Okay. Then thoughts lah. Okay, then
The next one.
yang berkaitan dengan So berkaitan dengan kita punya pemikiran pula, tadi kita ada emotion, thoughts, physical and behavior. So kalau thoughts ni macam a lot of people with depressive symptoms, dia ada indecisiveness. Nak buat ke tak nak?
Yeah. The next slide please, Cecilia. Symptoms, thoughts. Okay, there we go. Yeah.
Ya. Nak buat ke tak nak? Nak pergi ke tidak? Lepas tu kita cakap kadang kita dengan dia macam tembus ke, orang kata tembus gedeng tu kan. Tembus. Sebab dia macam tak fokus. Tak fokus. Okay, kenapa ni? Tak dengar. Apa dengar ke cakap ni kan? And then kalau di kalangan anak-anak remaja, it's a trick because bila dia belajar, bila dia study kan, bukan cakap saya tak boleh fokus. Saya boleh faham. Cikgu cakap saya tak belajar, saya tak boleh hantar homework sebab saya tak faham. So these are things that is quite common in children and adolescents. And then criticism lah. Saya mau macam tu. Saya self-blame. Critic yourself a lot. Okay. Ini some of the thoughts that is going on lah. Some are very pessimistic.
Right.
Semua benda tak baik. Semua benda tak boleh. Okay. Alright. And then we go to the negative, yes. And then the other one kita go to physical symptoms. Physical symptoms ni quite common. I would say that 1 in 5 of those with depressive symptoms will go to their GP for physical symptoms. Okay, contohnya macam selalu komplain sakit-sakit. Sebab dekat Malaysia ni kita tak dapat MC untuk please like me an MC, I'm depressed. Okay, tapi
Yeah.
a lot of MC is being written for headaches contohnya,
Mm-mm.
stomach ache ataupun I cannot work today because I feel bloated, right? And then
Yeah.
tengok BP high. Okay, and then yang selalu related dengan depression is sleep problem. Okay, sama ada you sleep
Yes.
sikit sangat ataupun you sleep a lot. Kalau macam adolescent they sleep, sleep and sleep and sleep. Okay,
Yeah.
kalau appetite pula some will eat too little ataupun some will just eat.
Too much. Yeah.
Yang kita panggil apa? Comfort eating.
Comfort eating. Yeah.
Stress termakan, stres termakan. Dan bila tengok ada orang yang depressed kecil halu, kecil macam anorexia nervosa, ada yang depressed tapi besar.
Oh, very
So these are
extreme.
the,
The two
yes.
sides.
Yeah, the physical symptoms sebab physical symptom ni dulu kita tak ada, sekarang kita ada masalah ni. This one kan a lot of complaint. A lot of complaint. And then if in the GP, right, if you're working in the in the community, you can see that the same person is gonna come in for the same problem. If you keep treating the aches and pains with painkillers without looking further into depression or anxiety, then you will miss
Yeah.
these patients.
So do you work together
So
with the GPs? Like they will know when to send the patients to you instead if they
I
feel
think
that it's not
I think
just physical.
yeah, I guess like ada memang akan dapat referral daripada GP. Ada. So tapi kadang-kadang okay, it's very easy if the patient tell you, doctor I'm depressed, this is what I have. Okay,
Say,
but
yeah.
to know the subtle ones lah, macam these aches and pains, benda tu yang kita kena tengok. Kalau asyik datang untuk sakit perut je, kenapa okay. So like kids that have school refusal issues, kita ada anxiety kat sekolah ataupun ada problem kat sekolah kan, they presented with also aches and pains, and these
Yeah.
aches and pains is not buat-buat. It's not totally not buat-buat. It's something that is happening because your
Memang.
body tak boleh understand the stress tu dia jadi kat badan. Kan Sakina, kan kita kadang-kadang macam stress kan, sakit kepala, sakit bahu, kan? Ataupun kita ada irritable bowel. Same to kids lah.
Rasa nak
Cumanya
muntah.
yes, loya-loya.
Ingatkan rasa macam tak lah kan.
Kan? So and then if we can ambil MC, we can ambil cuti, we can ambil EL. But kids cannot. They still have to face, the school, whatever is benda yang dia tak suka. So they have to
Yeah.
still face it. So we must take note lah about these other symptoms other than, the thoughts and the emotions.
Physical. And we've got behavioral symptoms as well, eh?
Yes, behavioral symptoms ni contohnya macam see the behavior from whom is before. Contohnya macam dia memang bubbly, dia memang outgoing, tiba-tiba dia jadi isolated. Okay, ataupun dia tends to neglect responsibilities. Kalau dia dulu kerja yang baik kan, walaupun dia tak adalah perfect sangat nak hantar on time, tapi things are going, it's happening kan, tapi after a while you tengok macam performance dia deteriorate. Okay, and then changes
macam out
in
of character tiba-tiba.
Yeah, yes. And then changes in personal appearance. So dulu cantik, molek, comel.
Jaga.
Tiba-tiba macam alamak kenapa lain sangat ni kan. I mean dia
macam tak kisah lah, whatever lah.
Macam dah tak kisah rupa dia macam mana. Kalau dulu suka pakai eyeliner, sekarang tak pakai eyeliner lah dia, kenapa benda macam tu, benda satu-satu lah yang yes. Kalau yang terlalu teruk tu you can see lah, tak ada tie ke, tak ada butang ke, tu memang kenapa tapi ada yang dia sikit-sikit tu.
Yeah.
Okay, alright.
So doctor, okay, from all these symptoms, let's say if we have somebody that we want to point out that maybe there is a problem, what's the best way that you know that you can actually approach? Takut nanti kan kita cakap benda salah pula, nanti orang tu jadi lagi depressed kan.
Yeah, I mean selalunya kalau I nak approach my approach lah kan, sebab yang datang ke I semua memang dah referred for depression kan ataupun anxiety.
Yeah, that's right.
Yes, tapi kalau kita contohlah kita nampak kawan kita kan, maybe the setting is very important where we want to talk to this person. The setting, it has to be in a relaxed situation kan, ajak minum, ajak makan, because kita mesti berada di situasi yang dia paling comfortable. Contohnya macam she likes arts, Sometimes we do pergi art gallery dulu ke, benda yang tu lah menenangkan dia. Okay, then only we talk to we point out the symptoms lah. Okay, sebab
Okay.
bila you point out the symptoms dalam keadaan yang stressful, it
Yeah.
will escalate certain symptoms. Okay,
Okay.
tapi kalau
Alright.
kita tujuan itu adalah untuk approach kan, kita point out and then we hear what she wants to say.
Okay. So pick the
Then
right mood, pick the right
pick
setting.
the right one. Yes.
Alright.
And then you have to calm down lah. You tak payahlah interrogate. Don't interrogate. Why like this before? Ini macam ni. Kenapa berubah? When it's intrusive,
Lagi stress orang
it's
tu.
intimidating. Yalah macam apa? Macam polis kan, investigator.
Yeah.
Kan, I'm your friend. You have to tell me. I need to know everything.
Yeah.
No, so kita
So how do you get that person to not to tell you what's going on, but then just to acknowledge kata ada problem, so that maybe he or she can realize and seek professional help. You can't tell bahasa you need professional help. Itu memang lagi lah dia marah kan.
Okay. So again, we point out certain things that we are concerned. Nombor satu ialah concern. Nombor dua ialah empathy. Empathy tu maksudnya kita rasa macam kalau kita kat tempat dia, macam mana kita nak handle benda ni.
Right.
Okay? Dan baru kita macam pergi slow-slow lah untuk tunjuk okay, the symptoms you nak macam mana. Kalau misalnya severe symptom, for example some depressive symptoms is very severe, sometimes they hallucinate. Sometimes they have suicidal thoughts. Okay? Or persistent anxiety. That one is I'm going to tell them, okay, I'm not going to leave you alone. Okay, let's do something about it. Let's, find someone that we can talk to, because those severe symptoms memang kita tak boleh tinggalkan dia. Okay, and see how she reacted. Sometimes dia berbincang pasal depression tapi dia relax. Certain people when they talk about their problem, they become restless, So yang the more restless they have, the more you cannot leave them, and until they calm down a little bit. Okay, then baru okay, let's go and see someone, let's go and get treatment. I'm gonna support is very important.
Yes.
Kalau you nak air teman. Okay, something like that. Then check up on them. Check up on them means you see what they need. Sometimes they just need somebody to fold the clothes ke. Sometimes house is like a shipwreck ke. Okay? Sometimes food tak ada dalam peti sejuk ke. So all that support, kalau kita tak boleh buat banyak, kita support cara
Good advice. Good advice. Okay, Doctor, you've got a slide here that's very interesting. It shows a picture of a brain. It's a skull punya X-ray. Okay, take a look at this. And it shows some areas of the brain yang light up and some areas yang not so. It's not so lit. What are those? What's the color? What does it say?
Oh, okay.
This one.
Yes, so a lot of people just say that depression ni macam tak ada bukti pun you ada depression, ataupun
psychological.
You kena bersabar, ataupun you kena semangat, a lot of people will say that, and it's quite intimidating for people who actually is going through this. Okay, bersabar, what do you mean bersabar? Ataupun satu lagi ialah cuba solat zikir, as if that people who have depression ni macam kurang bersolat dan berzikir. Example like that. But actually when you go through depression, ada sesuatu yang berlaku kepada you punya brain. That's why this is where the studies being done, and this is where medication works. Okay, so dalam depression kita ada satu chemical yang kita panggil cortisol. Cortisol ni is actually a stress hormone. Okay, and it is being produced in the hippocampus. Hippocampus ni ialah untuk memory. Okay, so bila cortisol ni banyak, hippocampus kita akan mengecil. When it becomes smaller, this is when you rasa macam people with depression macam tak boleh nak ingat benda. Macam cakap dengan ni susah, bukan ingat pun, they tend to have lupa, tak boleh fokus macam tu. Okay, then the other part of the brain, it's called the amygdala. Amygdala ni it control emotional response. So bila you are depressed, the amygdala tends to be bigger. So semua benda akan jadi lebih emosi, orang kata. Lebih emosi. Orang cakap sikit,
dia magnify lah.
Dia magnify a lot of things. Okay. And then it also disturbs the sleep, because if we are so magnifying everything kan, kita rasa tidur pun tak terkawal. Okay.
Yes.
And then it also causes changes in other hormones lah. In other hormones. And some parts of the brain in depression don't know why. sometimes tends to be inflamed. Inflamed ni maksudnya macam bengkak sikit.
Mm-mm.
Macam bengkak sikit. So maksudnya nak kena, it happens, your brain tu sebenarnya something happen to your brain. Tapi tak adalah semua patient yang ada depression kita akan scan. Okay, ini hanyalah untuk prove that something happened in your
Yeah.
brain. It is a brain disease. It's an illness that fortunately ada treatment. Ada treatment.
Okay. So the treatments, medications, as you mentioned.
Yeah, the treatment ada variety, the variety of it. I mean kita ada psychological treatment whereby kita akan cuba untuk ajar untuk proses, ajar untuk change behavior, ajar untuk change thoughts. Okay, there's a lot of treatment psychological treatment yang ada, and then there's medication. Okay, so kita makan ubat untuk balance up certain hormones that is affected in the brain during depressive episodes. Okay. Yeah.
Okay. Shall we take some questions, Doctor? It's just that it's very interesting. So there's so many things to address. There's also something in, before we go to the questions, so there's something that's very, very interesting in your slides. It's about being mindful. So what's this got to do with being depressed? And how does this help?
I mean, bila kita depressed tu, apa yang berlaku ialah we tend to, kita sekarang berada di sini and now, okay? What depressed people usually do is that they go ke belakang, Dia selalu ke past, I keep thinking of the past. Why me? What happened to me? There's a lot of regrets, of what happened. And then lepas tu, mainly why me? Kenapa berlaku kat saya? Kenapa saya macam ni? Those questions that cannot be answered. Okay,
right.
And the more you think about what is happened in the past, the more depressed you are because there's nothing you can change. One thing about depression is that you can't change what happened in the past. Okay, so being mindful is about being in the now. In the now means kita tak akan fikir ke belakang sangat, kita tak akan fikir ke depan sangat, kita berada in the moment. In the moment.
Be present.
Be present, yes. So kalau kita cerita pasal mindfulness ni, sometimes it's very difficult to, kalau misalnya I talk to children and adolescent, right, they say what is mindful, apa akan berlaku pada waktu itu. Being mindful is about being present. Okay, macam mana kita tahu kita present ialah through observation.
Yes.
Kita observe apa yang berlaku depan kita, kita akan observe kiri kanan kita akan observe sekitar kita. Number one is observe. Number two is being able to describe. Okay, nak tahu kita fokus atau tidak pada present is describe. Contohnya, I cakap ada 2 kursi, sekarang temperature is 20, okay, and the room is quiet. Okay, so benda-benda yang berlaku sekitar kita. Okay, and then kalau tak tahu sangat, then I usually ask the patient, okay, tengah anxious ke, tengah depressed ke, kan? Okay, because you keep thinking about that, kita nak tutupkan fikiran kita tu, kita fokus dengan apa yang di depan kita. Jadi kita pakai our sensory. Okay, the 5 things that you can see, the 4 things here, okay, the things that you can feel. Okay, kita akan tanya how the skin kan? You rasa tak bahagian tubuh you yang kena dekat kerusi contohnya? Orang tak pernah perasan benda tu bila dia duduk. Bahagian tubuh mana yang bersentuh dengan kerusi? Duduk je. Sometimes I just ask them, from your car to my room, what do you see? They was like, doktor, saya terus sampai dekat bilik doktor. Kadang-kadang kelakar juga macam tu kan. You don't see the toilet.
Macam magic.
You don't see, macam magic. You don't talk to my nurse.
Tiba-tiba sampai.
Tiba-tiba sampai sebab they are not focused. They are not paying attention. Okay, your mind is somewhere else. This mindfulness is also helping with anxiety. Anxiety is when you too much future, you uncertain and then you takut, kan? And it become overwhelming. So the same thing, you also apply this. Okay, and kalau misalnya I work with children ataupun sekarang kan kita ada hobbies, things that we like to do. For example, I think ada video clip. Contohnya kita suka tengok video clip. Kadang-kadang kita tengok je, tak ada apa pun, ataupun kita dengar ngaji ke, kita dengar, kita tak ada perasaan tau, macam kita tak fokus.
Macam background, just background.
Background je. Kita tak fokus orang yang mengaji tu pakai warna apa, baju dia colour apa, sebutan dia bagaimana. Hari ni dia pakai mask ke tak pakai mask. Okay, then ayat dia kenapa tulisan ni susah dibaca. Benda tu kita tak perasan sebab kita tak
Yeah.
describe, Tapi
Yeah.
bila kita start to describe, hari ni ustazah pakai baju hijau. Oh, lepas tu ustazah pakai niqab, sebab tu dia tak pakai ni. Oh, lepas tu dia ada
Ya,
pakai
betul juga kan.
microphone.
Ha.
So
Sometimes you
bila
tengok, you can be watching but then you don't know how to describe after that. Means you're not really
yes,
present. Good point,
don't
good
present
point.
sebab fikiran kita duk fikir ke depan, ke belakang lah, nak masak apa lah. Nak balik pukul berapa, benda-benda macam tu. Sekejap lagi husband balik macam mana.
Yalah.
So be present. So bila kita be present, most of the things akan jadi lebih meaningful. And then untuk student sometimes it creates curiosity. Kenapa cikgu ni cakap macam ni ah? Then bila you ada curiosity yang daripada mindful tu, you akan macam kena carilah jawapan untuk ni. Kita kena buat macam ni. Benda macam tu. It create that lepas tu apa nak buat? Lepas tu apa? Jadi benda tu jadi seronok lah sikit sebab macam kita ada
Oh, tu yang
accomplish
doktor
something.
cakap. Yeah, you mentioned much earlier tadi, you said, okay, and then what? So there's always something
Yes.
always something
Look
to
forward to.
Yes, correct.
Jangan jadi
Okay.
obsession pula.
Yalah.
Ah.
Padu.
Yes.
Okay, Doc, let's take a look at some of the questions that we've received.
Okay.
From Ms. Gwen Yap, at what point or what are the signs that alert us to go and see a doctor for help? Yeah, when does it become serious?
Okay. Satu, usually kan, you look at how long the symptoms in. Because the diagnosis of major depression or the symptoms has to be present for at least 2 weeks. 2 weeks, okay, and the symptoms are quite severe and debilitating. Means ada macam banyak benda yang you tak boleh buat lah. Number 3, there's presence of thoughts about harming yourself, ataupun thoughts about you wanna escape something, okay. And then the other one, if you start to hallucinations, you hear voices, okay. Tapi itu when things go more severe. Kalau ada tu je memang you kena datang jumpa doktor lah. Okay, but at any point of time, hallucination, yes. But at any point of time, you rasa macam you are not well, you want to get better, you have a lot of body symptoms, just see someone, and kita akan justify lah sama ada you ada depression ke, something that you want to refer to counselor ke, we can refer you to support group ke, okay?
Yes.
Because distress tu berlaku sebab kita tak ada cara, because not everyone know everything. We must acknowledge that we don't know everything. So there are people who know something else.
Yeah. The outlets that they can reach out to. Okay. There's one from Miss Sun Yap. Hi, doctor. How to make someone, adolescent or young adults, share their problems with you openly without pressuring them into it? Good question.
Yeah. Again, it's about doing something yang kita sama-sama suka, yang kita, kalau kita tak suka pun, one approach, contohnya adolescent lah. I have one adolescent who didn't really speak to me, and dia ada autism pula tu, mild autism. So lepas tu I got to know yang dia memang ada depression sebab dia bila mild autism ni, you look normal, you act normal, but you have some problem in terms of communication kan. So then I got to know that this boy loves anime.
Okay. Oh, this is the example yang tadi tu.
Yeah, so this is my talking point. So you nak dia dalam waktu tersebut kita boleh relate dengan sesuatu yang dia suka. Dia rasa understood. Okay. Kalau adult tu make cakes, jadi cake. Masa buat cake tu you discuss pasal cake saja. Tapi kan masuk cake sikit.
Sorry, tak dengar that last part, Doc, because the sound just went off again. Apa tadi, that last thing that you said?
During the things that kita buat yang bersama mereka tu, kita boleh selit sikit kenaan kehidupan. When you take sometimes kita membawang kan, berat benda-benda lain, kita sakit je.
Yeah. Dekat dalam kereta, doktor, that's usually like a space kan, it's just you and your child ke?
Thank you for pointing that up, because dia ada beberapa situasi kalau nak bercakap dengan anak, situasi yang baik. Contohnya macam during travel, there's two of you. Okay, dia tak ada adik dia lain nak ganggu. Okay.
Oh, the sound is connection dah quite bad dah, doctor. Sounds like tak berpendengar sangat. Hello?
Yes, I can hear you. Yes, I can
Okay.
hear you very well.
Okay. All right.
Okay.
Let's take a look at other. What's the earliest age a child can go through depression? From Shaila
The
Azwin.
earliest age,
Yeah.
I
From
have
your experience, what have you seen?
I have six,
6 years
six.
old.
Yeah.
Oh.
I mean,
What
usually
the
depression,
cause?
dia it's biasa kebanyakan mereka lepas puberty, when there's 11,
Yeah.
12 and so on lah. And then when they reach like adolescent, lebih kurang sama masa dewasa. Tapi sikit-sikit masa kecil ni, small number like 0.5 ke macam tu. I can't really quote to you, but less than 1%
Yeah.
will also
Yeah.
have depression
But how do you
and
diagnose a
present.
child?
Mhm.
How is it
Okay,
that
kalau
depression presents itself in a child?
kalau budak kecil, if in small kids, okay, mereka kalau depressed kan, mereka akan present dengan behavior issues, behavior problems. Okay, I
Uh,
give you example. Okay, okay, kalau puberty ni dia ada banyak tantrum, banyak somatic
Tantrum.
complaints,
Mm-hmm.
irritability, anger. They talk a lot. They talk and talk and talk and talk because they can't make sense what's happening.
Mm-hmm. Yeah.
Kalau adolescent or adult, they are more quiet, they are more
Yeah.
isolated. Tapi
Oh,
kalau
that's
budak
very
kecil
good.
ni,
Cakap je.
banyak cakap, dia berhenti dia cakap ni kan. Lepas tu
Oh.
memang nakal. Kita kata macam, doktor anak saya ni nakal sangat, tolong apa masalahnya. Then we found out, parents are going through divorce, example.
Yeah.
Somebody yang memang dia attached to pass away. Okay,
Yeah.
tapi dia tak boleh nak cakap benda tu kan. Jadi dia come dengan
Yalah.
a lot of behavior issues.
Yeah.
Yeah.
Okay. Miss Mishu ada question how to reduce anxiety.
In what in who? In how to reduce anxiety in general?
Generally, I guess. Yeah. How do you reduce anxiety? Maybe any tips and advice that you may have?
Okay, firstly, anxiety is something yang preventable. Kalau dia ready itu something else. Tapi first kali ialah lifestyle, healthy lifestyle. Okay, sleep
Okay.
time, eat on time, all those things lah.
Yeah.
Okay. Tapi kalau dia, then mindfulness is very helpful in anxiety because mindfulness, you memang nak start harder. First is to identify your symptoms anxiety tu apa kan. Okay, palpitation ke, shortness of breath ke, you dah start ada tu, then you start do relaxation. One of the best is that you buat relaxation is the breathing technique. Okay, and then you masuk mindfulness. Sometimes I just allow patient to just, okay, look at this pen and tell me about this pen. Describe this pen for me. Yeah, it's this length, it's blue color, it has a white handle, there's a logo, there's a small writing. When you
Yeah.
start focusing on something there, kita tanya lagi, dia macam, grounding orang tu. Okay, you are here, you are not whatever make you afraid.
Yeah.
So sometimes kadang-kadang boleh engage, kadang-kadang tak boleh sebab if it already escalated, just wait.
Yeah.
Just to let you
Uh-uh.
know, yeah, your anxiety usually lasts around 15 minutes. 15 minutes. Okay? And dia
Okay.
akan turun.
Okay.
Ah,
Maximum
yeah.
15 minutes of anxiety. Okay. Generally,
15 minutes. A lot of people say longer lah. Some of them say 30 minutes because bila kita anxious tu, kita rasa macam lama. We feel like
Yalah,
it's a
yalah.
long
Correct.
time. Yeah. So generally, you tunggu sikit, dia akan okay. That is if you have anxiety lah. It not mixed with other medical problems.
Okay.
Kalau kita ada,
Yeah.
heart problem ke apa, it's a different issue lah.
Separate lah.
Ah,
Yeah. Okay, last one. We've got a question by Ms. Dietitian Shazliana. Does essential oil help to improve mental health? What do you think of all these other holistic things that people use to handle mental health? Macam yoga, things
Actually,
outside external stuff.
stuff ni adalah sesuatu yang tak ada proof
Okay.
clinically lah.
Mm.
Okay, tapi I do believe that these practitioners, they have done small study or even testimony. So yang
Yeah.
alternatif yang lain ni is very much depends on a person. Dia sangat bergantung kepada seorang itulah, dan faktor-faktor lain tu biasa kalau kita buat study kan ada faktor ni, faktor tu,
Yeah.
faktor
Yeah.
keseluruhan, faktor kesedaran. Tapi yang bila kita buat study yang kecil-kecil ni yang only pertaining to certain kind of this, I cannot really give an opinion about
Yeah.
this. Tapi you tengok
Yes.
kalau dia sesuai dengan you means sesuai lah.
Correct. Yeah. Whatever
Kalau dia
works
tak
lah for that
bersesuaian
person kan.
then yes, yes, yang itu kena individually.
Okay.
Okay.
So doctor, before, sorry, carry on.
It's okay. Yeah. Yeah, no, I'm good. Yeah.
Okay. Before we wrap up today's program, because I think it's already 4:30, maybe in about 2 minutes kan, we can say goodbye and then see everyone another time. Maybe you can teach us all like a very quick relaxation technique, breathing or something that is very fast and you rasa, okay, we all can
Okay.
do this.
Okay. Breathing technique. Kalau kita the effective one is
Yeah.
actually breathing through your abdomen, because
Okay.
breathing through abdomen is actually more difficult than breathing through your chest. Okay. So kalau chest breathing macam ni lah. You can
Setakat
see the
situ je lah.
movement. Okay. Tapi breathing through to your abdomen is something more
Yeah.
difficult. Okay. Contohnya, I suruh you breathe. Now you breathe through abdomen without moving your chest. Is it possible? You know, it's not. This is not moving, but your abdomen je yang moving. Boleh ke?
Boleh, tapi macam perut besar tu kecil, perut besar kecil.
I
Is that correct?
tunjukkan sikit.
Okay.
Sometimes, okay, example. So, usually nak masukkan ke perut dia macam susah sikit. So the focus. Contoh okay, now breathe to the abdomen.
Okay. What are we supposed to
macam
feel?
tu. We are not supposed to feel our movement of our chest, but
Okay.
dekat abdomen. Sebab itu susah sebenarnya. Sometimes I need to close my eyes and focus for the air to move there, because a lot of time people will usually breathe this way, but not that way. Okay, so antara benda yang kita kena ingat lah in relaxation, actually is more of breathing through the abdomen is more effective than breathing through the
Okay.
chest. Okay, tapi kalau tak pun, you just breathe long. Kalau budak-budak, I selalu ajar, kat depan you ada balloon ataupun ada this
Yeah.
pinwheel. How do you blow it? You know, so you must take a deep breath and imagine that the balloon is inflating. Kalau you diam, then the balloon is not gonna inflate. Okay, so
Yeah.
kena nafas panjang and then inflate the balloon ataupun make the pinwheel move. Pinwheel tu kan yang kita tiup. Itu kan, sometimes I ask them to buy and then they will practice with the pinwheel.
Okay. So breathing, breathing is very important. Okay, or is there anything else that you would like to say? Something significant for everybody to know. What's
Okay,
really
so
important today?
the important thing is that yes, one is to those yang ada depressed symptoms, get help, itu to talk to someone. Okay, tak kira cakap dengan siapa, your friends ke.
Tak, kita dah macam disconnected dah. Macam StreamYard is telling us, okay, lama dah ni. Okay, sorry.
So
Okay, let's see.
Must talk to someone. Okay, so that person can help you. Okay.
Okay.
Kalau nak cakap, you can call lines, any hotlines. You just go to any hotlines.
Okay.
Okay, kalau ada banyak hotline, Befrienders, ada biasa, ada helpline, Buddy Bear sekarang ni tengah banyak. Okay, Women AIDS Organization. Okay, so just talk first, and
Okay.
get ways to get help lah.
Great. Thank you so much for your time, Doctor. I know that you're very busy. You've got so many patients. So thank you. That was Dr. Rahidah Abdul Rahim from Columbia Asia Hospital, Iskandar Puteri. She is the expert in this area. So if you've got any, if your child or your adolescent has any problems regarding depression and whatnot, you can always go and see her. She is a consultant psychiatrist with a specialty in children and adolescent matters. Okay, Doctor, thank you again. And thanks, everyone. See you soon for another episode of Dr. Go Live. Bye.
Okay, bye.
Bye.